Hey everyone, and welcome. I am absolutely thrilled to have you here for this explainer. Today, we're diving into something incredibly empowering. It's a practical, step-by-step guide to actually reclaiming your health agency. We're going to explore this brilliant, evidence-based framework from Dr. Lucy McBride, straight out of her book, Beyond the Prescription. Because look, this isn't just about managing random symptoms. It's about fundamentally changing how you interact with the medical system so you can finally get the kind of care you actually deserve.
So, tell me if this sounds familiar. Have you ever walked out of a clinic gripping a piece of paper but feeling completely, utterly lost? Or maybe your doctor cheerfully told you that all your lab results were normal, but you know you still feel terrible, and absolutely no one seems to be giving you any real answers. Well, if that resonates with you, let me just validate that right now. You are not alone. So many of us feel rushed, unheard, and just kind of frustrated by the modern medical system.
And there's a very specific reason for that feeling, which is perfectly captured right here by Dr. Lucy McBride. She's a Harvard-trained primary care physician with over 25 years of experience, and she makes a powerful point. The broken system is the problem here, not you. As she puts it, modern healthcare prioritizes transactions over relationships, screens over stories, and data over context. You aren't failing at being a patient. The system is just failing to see you as a whole, complex person.
Okay, let's dive into this, because right now, patients are being handed this completely false choice. On one side, we have conventional medicine, which, is often incredibly rushed, super data-driven, and highly transactional. And then, stepping right into that frustrating void, we have the massive wellness industry on the other side. They offer these seductive promises, telling you that you can optimize or detox or biohack your way to perfect health, often with literally zero clinical evidence and some very real risks attached. Dr. McBride points out that we desperately need a practical middle path here, one built entirely on your own health agency.
And that brings us to the core of our explainer today. We're going to use Dr. McBride's 5-step framework. Redefine health, map your ecosystem, know your personality, ask for help, and practice acceptance. Think of this as your roadmap to navigating all that uncertainty and becoming the CEO of your own body.
All right, let's jump in. Step 1, redefine health on your terms.
We really have to completely redefine what healthy actually means for you specifically. So many of us just assume it's an arbitrary number on a lab report or whatever a doctor tells us our target should be, but that is incredibly limiting. True health is deeply, deeply personal. It's based on your personal values, your daily goals, and your unique tolerance for risk. Good health for you might simply mean having enough energy to play with your kids, or feeling less daily stress, or just finally getting a solid night's sleep. When you actually align your medical choices with what matters most to your everyday life, well, every single decision you make becomes so much clearer.
And this brilliantly illustrates exactly what we're talking about. Imagine you have knee pain that's starting to slow you down. Conventional wisdom might push you straight toward knee surgery, right? But what if those daily hikes are your main way of busting stress? The prolonged recovery from surgery would take a massive toll on your emotional well-being because you'd lose your favorite coping mechanism. In that context, you might actively choose to manage it with medication over surgery simply because maintaining your mental health through hiking is your highest priority. Your personal values literally dictate the treatment.
Moving right along. Step 2, map your health ecosystem.
So once you've defined what health means to you, you have to look beyond just one isolated symptom. It's like a giant puzzle. Dr. McBride maps this interconnected big picture out beautifully as your health ecosystem, and it's built on 4 pillars. She calls them the 4 I's: informatics, inputs, infrastructure, and insights. By understanding and sharing these 4 quadrants with your doctor, you give them the full, rich story they actually need to properly guide your care. Let's break these down real quick.
First up, informatics. And yes, this absolutely includes your hard medical numbers, your blood pressure, lab results, imaging, all that. But crucially, it also includes your personal biography and your lived context. For example, if you just go to your doctor and say you have migraines, they'll probably just prescribe a pill. But if you share your personal context, like saying, hey, my migraine spiked right when I started caring for my aging mom, that gives your provider a massive context clue. Now they can offer far more accurate, holistic advice.
Next, we combine inputs and infrastructure. Inputs cover literally everything going into your body: food, medications, and even those late-night stress-eating patterns. It's the physical items plus the emotional drivers behind those choices. And infrastructure? That's the physical foundation that actually carries you through the world. Your muscles, your joints, your mobility. These two are deeply connected. If you tell a doctor, I can't comfortably get up from a low chair anymore,
You are handing them a huge clue about your physical infrastructure, which helps them tailor treatments that will actually work for your current mobility. The final pillar is insights, which is all about your emotional inner world. Look, we simply cannot separate the brain from the body. Your mood, your mental health, those unconscious stories that drive your behavior, they all directly impact your physical health. Chronic stress isn't just a feeling, it can physically raise your blood sugar. Anxiety isn't just in your head, it physically tightens your muscles, which can wildly intensify the pain you feel. Sharing your emotional state isn't oversharing, it is absolutely essential medical information.
Let's move to and see how this builds. Step 3. Understand your patient personality. Now, what's really interesting about this slide is how our ingrained beliefs and communication styles shape how we process health info. Most of us naturally fall into one of 4 patient personalities. Are you an optimizer? You might get super frustrated when your perfect diet doesn't yield perfect lab results. You really need to remember that genetics and just plain luck play a huge role. Or maybe you're a pleaser, always hiding your real concerns because you don't want to waste the doctor's time. If that's you, your homework is to practice stating your needs clearly. Then there's the internet warrior. You're consulting Dr. Google until you've researched yourself into severe worst-case scenario anxiety. You definitely need to set some firm online boundaries. Or finally, the outsourcer. You blindly follow the doctor's rules without asking why, which means you might miss the connections between your own symptoms. Self-identifying here is just a fantastic tool for becoming your own best advocate.
Which brings us nicely to step 4, ask for help. We all know that many of us hesitate to speak up in a medical setting. And the really frustrating reality is that even when we do voice our concerns, we still might not get what we need. The secret here is preparation. We're going to use specific, tested communication scripts to build a true partnership. So instead of just demanding, "Fix this," try asking, "Can you help me understand this problem, what's causing it, and what we can do about it?" Notice that powerful little word in there, we. Using we signals that you aren't making a demand, you're inviting a partnership. Dr. McBride notes that when physicians hear this collaborative phrasing, it frequently inspires them to dig a little deeper for you. But what about the awkward stuff? Things like bladder leaks, toenail fungus, maybe a declining sex drive, those are undeniably tough to talk about. Try saying, "This is hard for me to bring up, but I'm experiencing this issue and would welcome your guidance." By actively naming the discomfort right out of the gate, you cue the doctor, it signals them to respond with extra sensitivity, creating a safe space for you to get the help you actually need. And when it comes to new prescriptions, whether we're talking hormone therapy or maybe a GLP-1 for weight loss, never just ask a passive question like, "Can I take this?" Instead, frame it like this: what are the risks and benefits of this treatment for me? This specifically forces the conversation away from just generic advice and directly onto your personal goals, your unique health ecosystem, and your specific trade-offs. And finally, step 5, practice acceptance. So the crucial point is addressing a hard truth about being human. Some health challenges, whether it's our genetics, old injuries, or chronic conditions, they simply cannot be fixed or optimized away no matter how hard we try. But as Dr. McBride says, the moment you stop fighting what can't be changed, you free up energy to try what really could improve your well-being. Acceptance is absolutely not giving up. It is an active, empowering choice. If your lifestyle habits just aren't lowering your high blood pressure, accepting medication isn't a failure. It's choosing the path that allows you to feel better today, safely, in the actual body you have right now. And that brings us to the most fundamental question of all, one that is rarely asked in a doctor's office. Are you okay? Armed with this framework, you can finally start answering that honestly. You don't have to settle for just another rush transaction. You can map out your unique ecosystem, you can understand your natural tendencies, and you can advocate for exactly what you need. So as you prep for your very next appointment, I want you to ask yourself, are you ready to stop being a passenger and finally become the CEO of your own health? Thank you so much for joining me for this explainer, and I'll catch you next time.